I'd like to bring Dr. Kourosh Parsapour up to the stage as well as Lina Joy. Dr. Kourosh is the founder and CEO of personalRN. He has over 15 years experience actually in the front lines of healthcare, working in the ER and the ICU. His first startup was actually Telepeds, which was acquired by Specialist On Call, and he's now focused on building new solutions with personalRN. A mobile health coach that actually provides patient education from admission to discharge as well. And this will be the first ever demo of the StrokeApp here at Health 2.0, so looking forward to seeing that too. So, gentlemen.
So hi. Over the past 15 years, unfortunately, I've had to admit many patients with life-altering diagnoses, and they're scared. That's what's really going on, and their families are scared. They have to learn a large amount of complex medical information in a short period of time in a language that's essentially foreign to them. And this gap in patient engagement is really what motivated us to want to build something, a brand new, better inpatient education process. So without hesitation, the StrokeApp is our first product. This part of the StrokeApp, this is the first part, and it's designed specifically for the busy ER and ICU physician that basically needs to put in the information very quickly in under 2 minutes so it's not obtrusive to their workflow. The information that's provided to it, the information that's provided, the patient-specific information, actually begins to drive the content that the patient will see. So the information will speak directly to the type of stroke. It'll speak to the disabilities the patient might have, and also some of the severity scales which will impact the outcome, the management, and some of the other comorbidities that'll also play a big role, as you can see here. The content is also personalized to speak to the patient, and more usually, though, the caregiver, if they've had a stroke, and it'll continue to adapt and really provide relevant content as the patient moves through the ER to the ICU to the floor and on to discharge. And as you see, that it's done here, and it's ready to be handed to the patient. So, and immediately, StrokeApp starts teaching. Now, when we decided to build this part, we decided to put 3 limitations on ourselves in order to overcome them. The first one was that we assumed that the patients have never seen an iPad or tablet-based technology. The second one was that they read at a 4th grade reading level, and the third one was that they have physical or visual impairments that might inhibit the appropriate use of the app. We also tried to put some of our bedside manner in there, trying to be calm and provide comfort to caregivers and patients that might be anxious, that might be scared. So we were always trying to prepare them, though, for the challenges that they have to face. The content is always displayed in this format regardless of the care settings, and you can see the care settings on the bottom with the location bar, the emergency room, the ICU. All the information is always provided in the same way. What happened to me? What's happening to me now? And what's going to happen to me? What's expected? And the information is provided in a bite-sized, digestible format, so it's not overwhelming to the patients. But what's really important is that the content is actionable. Now, one more, and we're there. So as you can see here, there's in this use case, the patient is in the ER, they're doing blood work, and they're gonna check blood counts to see what the red cells are, the white cells, and the platelets. Now, platelets are responsible for clotting, and the app prompts the patient to say, or the caregiver, is there any easy bruising in the family? And if there is, maybe you should tell your healthcare team when they get here. But it also directs you to the Me Diary. Now, this is really exciting because the Me Diary is a repository. It stores all the inpatient information that's curated, that's important for the user, not important that what we think is important, but what they take from their experience. And through the experience, their health information becomes more robust. They fill a lot of this stuff in. And this is what actually integrates with Apple's Health Kit. And if there's any elements that they may have issues with, questions that they have for their provider, the provider may not be there, they would basically type in the questions, and when the provider, the doctor or the nurse comes back, they would answer the questions, and it would be time-stamped, and this is really important for these patients because then they have something as a point of reference. Ultimately, this ends up becoming transferable onto your mobile device, and now the patient has increased access to health information that's relevant. It's theirs, and it's brought into a system that can actually become a meta portal potentially as things progress. Thank you.